Hello, my name is Reggie Gilstrap, and this is my head-to-chest assessment. Just me, the student nurse. Hand hygiene. Provide for private patient privacy. Hello, Mr. Gilstrap. How you doing? My name is Joey. I'll be your student nurse today. I'm doing okay. So the reason for me coming in today is because I need to do a head-to-chest assessment. It'll take about 15 minutes. Is that okay with you? All right. The first thing I need to do is I need to get two patient identifiers. Can you tell me your name and date of birth, please? Awesome. Do you have any allergies? That's good. Alright, so I'm going to check your pain level. On a scale of 0 to 10, 0 being no pain, 10 being extreme pain, can you tell me what type of pain you're in right now? Very good. Alright, so the first thing I want to assess is your general appearance. And what I'm looking for is any signs of acute distress. What that would look like is you leaning forward and leaning on your hands trying to catch your breath, okay? Having shortness of breath, maybe being diaphoretic, sweating, or maybe having pale skin, maybe stressing your neck muscles, showing that you're really having problems trying to breathe, acting erratic. None of those of what you're doing, okay? You're sitting there, you're sitting up, you're being attentive, you're paying attention, you're being polite and courteous, alright? So I know you're good, okay? So the next thing I want to do is I want to check your alertness, okay? Your level of consciousness. So I'm going to make sure you're oriented to person, place, time, and situation, okay? So the first thing I want to do is ask you, do you know your name? Alright, Talon. And can you tell me where you're at? The hospital. Can you tell me what time it is on that clock on the wall? 7:45. Alright. Alright. And then can you tell me why you're here? Alright. So the next thing I'm going to do is I'm going to look at and assess your behavior. I'm going to look at your facial expression, okay? Your mood, and make sure that it's appropriate for the situation, of which it is. Alright? Your behavior is normal. You're at an appointment. Your facial expressions are appropriate for the situation. And your mood is light, okay? You're just answering the questions, being polite and courteous and listening, okay? Now, what I've been doing since I walked in here and started speaking with you is I've been paying attention to your speech, okay? And what I've been looking for is to make sure that you're making sense when you speak, that you're talking in complete sentences, and you're being clear and concise, okay? And making sense, all of which you're doing, okay? So it's all good. So before I came in here, we got your vitals, and I'll tell you the results of your vitals. Your temperature was 98.6, your heart rate was 80, your respirations, or 80 beats per minute, your respirations were 16 per minute, your oxygen saturation, or your SpO2, was at 98%, and your blood pressure was 110/70, all of which are within normal limits, okay? So the first thing I'm going to do now is check your skin and your nails, okay? When I'm looking at your skin, I'm looking for color, any signs of lesions, wounds, or incisions. Just a heads up, in a hospital setting, my patient would be in a gown, so that way I could actually visually inspect and assess my patient's skin. Due to the video, I can't. So, looking at your skin, I'm looking at the color. Your color is appropriate for your ethnicity. I don't see any signs of any lesions, wounds, or incisions. Can I look at your back, please? Awesome. Alright, so your skin is intact, okay? It looks good. Can I see your nails? I'm going to look for signs of clubbing, which is an abnormal curvature of the nail, okay? I don't see any signs of clubbing on my patient. I also looked at the color. The color of your nails, pink, which is normal, okay? I want to check your cap refill rate. And what I'm looking for is basically how fast oxygen gets back to your tissue, okay? I'm going to press down on it. Patient's cap refill comes back within 1 to 2 seconds, which is normal, okay? Now I'm going to check your skin. I want to look at the temperature, okay? So I'm going to feel it with the top of my hand and just check your limbs, okay? Alright, so your skin was warm and it felt like it was moisturized. It's clean. It looks good, okay? The next thing I'm going to do is I'm going to inspect your head, your face, and your neck. When I inspect your head, what I'm looking for is any infestations, alright, or any lesions. So is it okay if I touch your head? Now, when I say palpate, I'm just going to kind of dig around in there and look, okay? No signs of lesions or infestations. All right. I want to also inspect your face, okay? And what I'm looking for is making sure that it's symmetrical. I'm making sure the left side matches the right, which it does. Very good. Your facial features are symmetrical. Your left matches your right, okay? Now I'm going to look at your eyes, and what I'm looking for when I look at your eyes is I want to inspect your external ocular structures, okay? So I'm going to look at it, and I'm going to look for any redness, any secretions or discharge, okay? So I'm looking at it, and I don't see any signs of redness or any discharge, okay? Now, is it okay if I pull down your lower eyelid? I'm going to inspect your conjunctiva, and then I'm going to look at your sclera, okay? And what I'm looking at is the same thing. For any redness, I'll look at the color, and then I'll look for any discharge, okay? Alright, the color of your conjunctiva is pink, which is normal. No signs of redness or discharge. Looking at your sclera. Sclera looks good. It's white. No, it's not red, and there's no signs of discharge, okay? The next thing that I'm going to do is I'm going to look at your pupils, okay? The first thing I'm going to look at is size. The size of your pupil is within normal limits, okay? They're equal, alright? The next, after that, is I'm going to look at if they're round, which they are. Your eyes are round. Your pupils are round. Alright, and then I'm going to look to see if they're reactive to light, okay? So I'm going to pull out my pen light, and I'm just going to block half your face off. I'm going to shine it in your eye, make sure that it constricts and dilates, and then do it to the other side, okay? Alright, it was really good. They constricted and dilated as they should have, okay? Now I'm going to check the accommodation. I just want you to stare at this pen light, and I'm just going to move it towards you in a way, okay? Ready? Alright, good job. Can you read this line right here for me on the wall? Alright, very good. Alright, so your eyes checked out, look good, okay? I want to inspect your ears, and what I'm going to do is I'm just going to pull down right there, and I'm going to look at the external structures and make sure there's no signs of drainage, okay? No signs of drainage in the right external structures of the ear. No signs of drainage in the left external structures of the ear. So it looks good, okay? Now I want to do something called a hearing test, or a whisper test, I'm sorry. And I'm just going to whisper a word in your left ear, and then I just want you to repeat it out loud, and then I'll do it on the right, okay? Alright, very good, very good, very good. No signs of hearing loss, okay? Very good. The next thing I'm going to check is your nose. And what I'm going to look at is your internal structures and make sure there's no signs of any deformities, okay? No signs of deformities. Alright? When I looked in there, everything looked symmetrical, okay? And there were no signs of inflammation or redness or swelling, okay? So it looked good. So next I'm going to assess your bilateral patency. So can you go ahead and close that left nostril and try to breathe out your right? There you go. Wait, this is your right. Alright. Go ahead, clog your left nostril. Alright, breathe in and out. Alright, could you do it? Alright, do it on the other one. Alright, very good. So, your left nostril and your right nostril were patent, which means you could breathe in and out of them, okay? The last thing that I'm going to look at are any signs of drainage, of which I see no signs of drainage, okay? Alright, so the next thing, can you lean forward for me? The next thing that I want to do is your mouth and throat, okay? So when I tell you, I just want you to open up and kind of hold your cheeks to the side and lift your tongue up, okay? And what I'm going to do is inspect your lips, your tongue, and your gums to make sure they have the correct color and that they have moisture, okay? Alright, can you go ahead and do that for me? Alright, everything was pink, so your lips, your gums, and your tongue were pink, and they had moisture, okay? So it looked good. Alright, so the next system that we're going to go over is your respiratory system, okay? And what I'm going to do is I'm going to take my stethoscope and I'm going to listen to your lungs, alright? I'm going to listen to it with this side called the diaphragm, okay? And all I'm listening for is any abnormal sounds like murmurs, okay? Or any clicks or clanks, anything like that, okay? And I'll just call out what part of the lung I'm doing or inspecting when I get there, okay? We'll do your anterior side, which is the front, and then your posterior, okay? Alright, so here's your right upper lung, left upper lung, still your left upper lung, still your right upper lung. And we're doing this in a Z pattern, okay? All this will be in a Z pattern. Alright. Now your right middle lobe, your left upper lobe, your left lower lobe, your right lower lobe. Alright, can you lift that arm up? I'm going to hit that middle lobe one more time right here, right middle lobe. Alright, are you dizzy? Okay, alright, we'll do the same thing. Can you stand up for me? We'll do the posterior side, same thing in a Z pattern, okay? Left upper lobe, right upper lobe, right upper lobe, left upper lobe, left lower lobe, right lower lobe, right lower lobe, left lower lobe. And then I'm going to hit that middle lobe one more time. Can you lift up? Right middle lobe. Alright. Alright. I didn't hear any unusual sounds, okay? No, nothing crazy. No abnormal sounds. Alright. Also, while I'm doing the respiratory system is I'm making sure while you're sitting here that you're not using any accessory muscles when you breathe, okay? Accessory muscles would be like you tripoding over, using your intercostal muscles, okay, in between your ribs, stressing your neck muscles, alright, flaring your nostrils. That would be signs of shortness of breath, okay, or respiratory distress using your accessory muscles, okay? No signs. So the next thing that I'm going to do is I'm going to listen to your heart, okay? Now when I do this, I'm going to use the diaphragm first and the bell, and I'll call out the structures, and I'll also call out their location. But before I do that, I want to take a look at your carotid or your carotids, okay? I'm going to check your carotid pulses on the left and the right. I'm going to check one first, and then I'll check the other. I won't check both at the same time, and that's due to because that's how your brain gets blood. And if I cut off the oxygen supply, then you'll pass out, okay? I'm going to touch you, all right? All right. So your pulses were normal at 2+, okay? The next thing I want to check for is something called jugular vein distension. The jugular veins are located on the side of your neck right here, okay? And I'm going to lay you back at a 45-degree angle, and I'm just going to look, and what I'm looking for is to see if they're pulsating out, okay? All right, lay the patient back at 45 degrees. No signs of jugular vein distension. All right, very good. All right, now I'm going to listen to your heart, okay? Now, just like I did the lungs, I'm doing the heart. Just like when I inspected your skin, it's all underneath the clothes, okay? I want to make sure I keep reiterating that. It's always underneath your clothes. The first one that I'm going to listen to is called your aortic valve, okay? And this is your sternum. It's going to be to the right of the sternal border, second intercostal space, so between the second and third. That is your aortic valve. Your pulmonic is left sternal border, second intercostal space. Your tricuspid valve is left sternal border, fifth intercostal space. And then your mitral valve, which is left mid-clavicular, fifth intercostal space, which is your mitral valve in the Erb's point. All right, so that was with the diaphragm. I'm going to listen with the bell now, okay? Same thing. Aortic valve, right sternal border, second intercostal space. Pulmonic valve, left sternal border, second intercostal space. tricuspid valve, left sternal border, fifth intercostal space, mitral valve, and Erb's point, left midclavicular, fifth intercostal space. All right, sir. I didn't hear any abnormal sounds, okay? Your heart sounded good. The last thing that I'm going to do before I close this out is I'm going to check your radial pulses, okay? Your radial pulse is located right here on your wrist on the thumb side, and I'm just going to check each one, okay? Check them for 1 minute. All right, they're rated at 2+ bilaterally, okay? Each one was at 2+, which is within normal limits, okay? All right, sir. Can you tell me on a pain scale again what pain you're in, rated 0 to 10, please? All right. I'm going to make sure your bed's locked. Yep, it's locked. It's as low as it goes. Your side rails are up. All right, sir, so that concludes my head to chest assessment. Do you have any questions about it? Okay, everything was within normal limits. Okay. Here's your call light. All right. If you need anything, call me. I want to thank you for letting me do this head to chest assessment, and I hope you take care and have a good day, okay? Hand hygiene. I'm out.